Hello there, psych students. Welcome again to another video lecture. We are going to enter into our next life stage, which is middle adulthood. Technically, this is from ages 40 to about 60. And most people know it as middle age. Okay, so that's kind of what we're looking at. In this particular lecture, what we're going to discuss are the different changes in physical development. We're going to look at some different angles related to that and so forth. All right, so let's open up our slides here and we'll talk about middle adulthood. Once again, middle age is kind of what we're looking at, and we're going to focus on the physical development of that. So physical development in middle adulthood. What we're going to start off with here in this particular lecture is health concerns. Okay, so health concerns of middle age. It turns out when we research this stuff, we find that, reasonably so, concerns about health rise during this stage. So during middle age, we seem to be very concerned about our health compared to, say, maybe when we were younger. Why do you think that is? Why do you think people would be concerned about their health during this time frame? Well, probably because we've had more firsthand experiences with things like illness and death. Whether it's our friends, our spouses, possibly even our own parents, for example. It seems like this stuff could potentially be all around us and seems to be on our mind a lot. Not only that, you experience a lot of changes in your body, and these changes that we're experiencing during this time seem to be a lot more abrupt than ever before. So we said, even going back to early adulthood, there's changes, and we talked about that, but now you're really starting to notice those. I mean, every time you look in the mirror, you see changes. You just don't feel the same when you wake up in the morning and get out of bed. I mean, I can tell you as someone who's middle-aged, sometimes it hurts to get out of bed and it's difficult to do. It's not like when you're 20, when you just pop out of bed and you feel refreshed. So a lot of these changes are a lot more prevalent, including the way our skin looks, the way our hair looks, our fingernails are becoming thicker, for example. So the point is that a lot of these changes seem more obvious now, and that makes us think about our health. Wow, I'm not young anymore. You don't feel the same. Maybe you're living in pain, for example. There's, it just seems like it's all around us. Okay, so research has confirmed this. Middle-aged adults experience more serious illnesses and deaths compared to younger people, younger adults. So because of this, it's really recommended for people in middle age to get tested for serious conditions, okay? So for women, for example, you want to get your regular mammograms. For men, that could include things like getting your prostate gland checked, which is not the most comfortable thing in the world, by the way. The point is that at this time in our life, as we've been around the block a few times, you want to take a more proactive approach to your health, because let's face it, if you catch a lot of these problems early on, they're a lot more treatable. The prognosis is a lot better if you catch them early on than if you wait and kind of put it off. Oh, I have this pain, I don't feel great, but I'm going to put it off. So once again, we want to catch those things early so we can take preventive treatment and get on it right away, okay? A lot of these changes that we're experiencing as a middle-aged person are very variable, according to what the research shows. And a lot of times they're due to not only genetics, but also lifestyle, as we've mentioned before. So it's the classic nature-nurture stuff here, guys, where both of those areas seem to be important. Another thing that also seems to be important and on our minds as a middle-aged person is our weight, right? Would you guys agree with that? That we live in a society that's very conscious of our weight. It seems like, you can't drive down the street or turn on your computer with seeing an ad about weight loss and diets. It's all over the TV. It seems that we really focus on our image, more specifically our body shape and how much we weigh and so forth in our society. So it's definitely on the minds of people, okay? So no exception here, weight is really a matter of concern for a lot of middle-aged people. This could be due to obesity rates that have climbed. So, once again, we see it around us a lot in society, and society really gives this message that you need to worry about that. Just to kind of give you some statistics here in terms of our body fat percentage and how that changes and how we would expect it to change. During adolescence, on average, your body fat percentage is only about 10%, okay? Where middle adulthood, it's 20% or even more. So it's going to be a very common thing to gain weight once you get past 30 for most people, right? And certainly in middle age. You know, this is something you kind of experience that. I don't know if you guys are old enough to go to a high school reunion yet. Some of you may have been able to do that, but I know a lot of you are still young. But when you go to your high school reunion, especially like the 10 and then the 20 year, you'll notice that everyone looks a little bit heavier than they did when they were, you know, in high school. So it's pretty common. We would expect most people to gain weight during middle age. That's a very normal experience, and there's some reasons for that. So let's take a look. A lot of times it's due to a decline in what we call our BMR, or our basal metabolism rate. So if you don't know what that is, technically, it's the minimum amount of energy individuals use while in a resting state. In other words, how many calories you're burning, for example, if you're sitting on the couch watching TV. Obviously, that rate is going to go down. So when you're young, your metabolism is very quick, you're burning calories. But as you get older into middle age, your body is just simply not as efficient as it was in burning calories. Your metabolism slows down, and therefore the bottom line is you have to work out and eat less, or you're probably going to gain weight during this stage. So if you're someone that values those kind of things, you really want to get off the couch and keep working out and watch what you eat. It's very, very important, okay? Keep in mind that this metabolism rate actually starts to drop pretty quickly after adolescence. So even as early as our teen years, at the end of that, we can find evidence that it's actually dropping even then. But certainly by the time you get 40, 50, it's going to slow down, and you have to take preventive measures in adulthood, of course. The problem with this, however, is that many or most middle-aged adults do not compensate for their dropping BMR. I mean, that's the sad reality of it, is that we're not compensating for that drop in our metabolism. In other words, remember, you have to eat less, you have to work out more, you have to make changes if you want to maintain this thinner body type or whatever you're after, okay? So let's look at some research here. So this research shows physical activity among US adults, the percent of us who are working out. So obviously health experts have a certain rate that we're supposed to be working out. This is actually pretty shocking here, and this is for all adults, but they're finding that only 48% of adults in our country are sufficiently active in terms of physical activity, meaning working out what the doctors and the experts are saying you should. 14% are completely inactive, okay? So think about what that means. And then 38% are insufficiently active. So in other words, over half, if you believe the study here, over half of American US adults are simply not working out enough, okay? Once again, that is alarming, knowing that that many people are sort of not sort of following those guidelines and working out, okay? So why do let's look at it, let's take the spin here with middle age. Why do most middle-aged adults not work out? Why don't they work out? Let me say it that way. Why do we see these high numbers, especially in the middle-aged population? Well, there's a lot of reasons you could argue for that. You could say that by this point of your life, you're committed to your job. Most of us, by the time we're 40, are really well into our career. We're devoted to that career. We're raising our children, or we're taking care of responsibilities, so we simply do not have time like we did when, say, we were 20 with less responsibility. So you could argue that we're just so motivated by work and family and sort of committed to our lifestyle that we don't take time of our day to work out. You could also argue it's lack of energy. You simply don't have the energy levels you did when you were younger. I mean, it takes a lot of motivation to sort of start that pattern and to work out. So a lot of us, by the time we're middle-aged, don't have that anymore, or it's a lot less, I should say it that way. You could also argue that by the time we're 40 and into middle age, we're enjoying the fruits of our success. We've worked our butts off our whole life to get to this point, to get to this job and to own these things and all that. It's kind of like, wow, I want to enjoy my life rather than spending my leisure time working out. So a lot of people kind of report that I've just worked so hard up to this point. I don't want to waste my time now by having to work out. I'd rather enjoy my time off and that kind of thing. So, you know, if you look at all those factors, you can kind of understand why it would be hard for people who are middle-aged to actually get off the couch and get going with exercising and hit the gym and so forth. So it can be problematic. All right, so next we're going to go to cardiovascular health, okay? There's no question that age contributes to heart disease, right? That's more likely as we get older. It's developmental in nature, but certainly it's linked to other things, including our previous lifestyle and even our eating habits, right? So the point is that how you lived your life when you were young, now you're going to really see those ramifications as you start to get into the advanced years, right? So in other words, if you were a smoker, a drinker, you ate crap your entire young adulthood, now you're really paying the price, unfortunately, when it comes to your cardiovascular health. So you have to kind of think about that when you're young, when you still have time to counter some of those problems or to make those major changes to prevent some of these things from happening. We're going to focus on diet. So obviously exercise, avoiding smoking, drinking are huge, but in this case, we're going to focus on diet. And we think that one of the major reasons that cardiovascular health is such an issue when we get older is the buildup of cholesterol, which we've mentioned before. So now we're going to get more specific. There are two major types of cholesterol that I want you to know, okay? So first of all, we have what's called the LDLs. So the LDLs are things that you want to avoid. It's known as bad cholesterol, or saturated fat is another way to kind of explain that. And this is found in things like whole dairy foods, red meat has a lot of this. Basically animal-based products for the most part have a lot of LDLs. And the problem here is that this cholesterol sticks to the artery walls when it gets too high, and therefore the heart has to pump harder to get that blood through to where it needs to go. So it's causing strain on the heart basically by kind of clogging up the piping, if that makes sense. So the point is that you really want to try to avoid this as much as possible. As we said in previous lectures, you want to make sure you're limiting this, you know, avoiding red meat and eating poultry and that kind of stuff, going with other options to prevent this from happening. The second type of cholesterol are called HDLs. This is known as good cholesterol, and this is what you want to incorporate into your diet. And we've discovered in research that this actually can counter some of the threats posed by LDLs, okay? So where would you find HDLs? Well, a lot of it is found in cold water fish, such as trout and salmon. I don't know if you guys like salmon. I love salmon. Such a healthy food for you. So cold water fish typically have a lot of HDLs, nuts and seeds, vegetable oil, omega-3s, for example. Those types of foods that have those substances or surround those things are usually high in HDLs. And the reason they're good for us, for the most part, is that they actually attach to the LDLs in our system and then help to carry them down to the liver where they are then processed. So HDLs can help to counter some of the threats posed by LDLs by attaching to them and then sending them on the way down to the liver where they can be processed by the body, okay? So to sum that up, guys, what you want to do is limit these LDLs and increase your HDLs in your diet, along with, of course, exercise and a healthy lifestyle. Those are really the best things you can do. Blood pressure and cholesterol levels are related to diet and exercise, obviously. So we know that having an excellent diet, which we've just talked about, and exercising can actually extend your lifespan if it's appropriate, okay? So you want to make sure that you are working out and making those appropriate changes in your diet. One of our biggest risk factors for a heart attack is the following. So I'm just going to kind of paint you a picture of one of our most high risk factors for having a heart attack. That would be being male and being middle-aged, someone who is obese, drinks alcohol, and has high blood pressure. Then if you even added smoking and those kind of things to it, it would make it an explosive combination. But being male, middle-aged, having high blood pressure, being overweight, and drinking, that is just a recipe for disaster as we're turning. That's one of our worst combinations. And so if you are a middle-aged man, you want to make sure that you're avoiding alcohol and eating appropriately, and of course working out, which helps to counter some of those effects. Keep in mind that blood pressure, high blood pressure or hypertension in middle age, according to research, has been linked to cognitive impairment in late adulthood. So now we are seeing studies that it affects your mind, your cognitive facilities in terms of being sharp when you get older. They've seen that sort of connection with hypertension of all things. I thought that was interesting. Okay, so this will kind of conclude our short lecture here on the physical development and health concerns related to middle-aged adults. Guys, please move on to the next step in the class.